This video was sponsored by Back Specialist Hospital.
I'm Dr. Charles John Buckman, obstetrician gynecologist. Usually, the labor starts from when the cervix is totally closed until when it is the presenting part. So it's not only the head that comes, you can have the bottom coming. So dilatation is up to 10 centimeters usually, but we usually use the head. The babies come with the head more than 90% of the time. Now, so for the baby's head to be delivered, the cervix has to be fully dilated, which is usually 10 centimeters. So when you measure, you get about 10 centimeters with the head fully dilated, right? Now, if it is less than that, the baby won't be able to come. But if you have about 8 centimeters or between 8 and 10, and there's an important reason for the baby to come, let's say the heartbeat is not doing too well, or any other complication that we need to deliver instead of wait for full dilatation, you can do a vacuum delivery where even if it's 8 or more, you can put a cup on the baby's head and pull. There's a pressure created and helps to pull the baby's head out. So you can do that after 8 centimeters, but usually for normal on-interventional delivery, it's 10 centimeters. Some of the things that can lead to a baby's heartbeat dropping, let me put it this way. There are some complications that can affect the heartbeat. Sometimes it can actually make it go faster than it should, or make it go slower than it should. Now, when you have hypertension in pregnancy, it can affect the placenta, and so blood flow to the baby sort of reduces. So with time, you can have the baby's heartbeat reducing, which gives you an idea that the baby is in trouble. The other thing could also be when, let's say, the baby's cord is trapped. Let's say it's being compressed by the fetus. Maybe the head is pressed on the cord, or something's pressed on the cord. It can lead to the heartbeat reducing also. Sometimes when let's say you have a breech presentation. Breech means that the baby is coming with the bottom instead of the head. So with that, if let's say you start your water breaks, the cord can slip out. The reason is usually if the head is presenting, the head is down, the head sits in the pelvis, so it prevents the cord from being able to slip out in case your water breaks. But if it is the other way, the bottom won't be able to occupy the pelvic cavity very well, so there will be space for the cord to slip out in case your water breaks. So once your water breaks and the cord slips out, you can have your baby's heartbeat dropping. And this is an emergency. If it's not taken care of quickly, you can lose your baby. There are other things like when the placenta separates before it's supposed to. Usually the placenta will separate when the baby has come out. Then it will separate, then the placenta too delivers. If it separates before your baby is delivered, it's called placental abruption. Placenta is separated before it's time to separate. With that, then blood supply to the baby will reduce, and then you can have a baby's heartbeats dropping. The other complication, like a uterus being rupturing, let's say a very long, prolonged labor, where the baby is big, and maybe we're not able to pick up that this is something that should end up in a cesarean section rather than allow normal delivery. You can have the uterus rupturing, where it will open and the baby will be floating in the abdomen. So with that, you can have the baby's heartbeat reducing. It gives you an idea that there's something, the baby is in trouble. It could also happen in somebody who is trying to have a vaginal birth after a cesarean section, if the person doesn't fit the criteria for that. Because sometimes, if let's say you've had 2 cesarean sections, you cannot have a vaginal birth. So some person will try to deliver at home, and then because she essentially wants to have a vaginal birth, even though she's been advised against it, you can have a uterine rupture, and with that, the baby's heartbeat will drop.
This video was brought to you by Back Specialist Hospital, and Fertility Center.